Okay. Hi, everyone. Thanks so much for joining us today. It's right at 3 o'clock Eastern, so I'm going to go ahead and get started. But this will be recorded and you will be able to access it afterwards, and we will share it with our Script Your Future Challenge mailing lists as well. But hi, thank you all for joining us today. I am Sam Sears. I am the Health Policy Associate at National Consumers League, and this is the kickoff webinar for the Script Your Future Team Challenge for our 2025 year. Next slide, please. Awesome. Before I get into it, I just want to give a overview of some of the National Consumers League um, other health programs. So we have the Health Advisory Council, which is our stakeholder engagement crew. We have Script Your Future, which is a larger education awareness campaign and consumer education campaign, as well as the Team Challenge. We have our We Can Do This podcast, which we have a sub-series within for health related topics, and we've been doing a lot of work over there. And we also have our Cannabis Consumers Watch, which is focused on cannabis products. Next slide, please. So the agenda for today is posted here, but we're going to go over introductions of both the NCL team and the WSW team who help manage this campaign with us. We're going to discuss why medication adherence and vaccine confidence as the focus. And then we'll go over the campaign and the team challenge, and then we'll have time for questions and answers. And like I said before, we are recording this and we will circulate it after. Next slide, please. So our staff this year are myself as the Health Policy Associate at NCL, and then Chelsea Hickman and Madison Spencer, and Madison's on the screen here as well with us, are based out of WSW, Winning Strategies Washington, and they help us quite a bit with this. Next slide. So medication non-adherence is really the why behind Script Your Future. We know that non-adherence of medication is a widespread public health issue, especially for those with chronic conditions. It's fairly common, as you can see, some of the statistics about people who either never fill their prescriptions or don't take them as directed are pretty intense. It's also a dangerous issue to struggle with. Those with chronic conditions, especially, are putting their health at risk if they don't take their medication as directed. And it's also a costly issue for American consumers. About 1/3 of medication related hospital admissions are linked to poor adherence, which is totally avoidable. And it is an issue that should not be costing patients billions of dollars a year as it currently is. Next slide. So the Script Your Future campaign is a national consumer education campaign, which provides medication adherence resources as well as raises awareness about the issue. Um, the focus is on several areas outside of medication adherence as well, including vaccine confidence and uptake, managing chronic conditions, and overcoming disease stigma. We launched this program here at National Consumers League in 2011 with the support from the Agency for Healthcare Research and Quality. And since then, we have enjoyed support from a wide array of partners, both within industry, government, and other partner stakeholders in the space. Next slide. The team challenge is also another core component of Script Your Future. This is the 2025 challenge year is going to be our 14th year. It's gone through some changes every year a little bit, but the core of the challenge has stayed the same, which is to increase medication adherence within communities. The challenge itself spans 3 months, so it runs from January to March. It is open to pharmacy and other health professional schools. We work with the schools because we want to engage the next generation of healthcare professionals. Um, and this year, we will continue to provide templates on our website, and teams will also have access to hard copies of materials. They just need to reach out to us, and they will also have access to their own versions online that they can print themselves. Next slide. Team challenge goals include to plan and implement education and outreach activities in your communities in order to increase medication adherence, to encourage the collaboration of interprofessional care teams. Like I said earlier, to engage with the next generation of healthcare leaders, to develop partnerships within local communities, securing media interest in your activities, and then to measure and report on your impact. Like I said, these core goals have stayed the same, although the execution and everything else may differ a little bit from year to year. Um, and collaboration is a big component of this, as well as increasing adherence, because healthcare teams are becoming more and more common than before. And in the course of your careers, you will work with people outside of just your pharmacy and maybe your clinic and all of that. Next slide, please. So these are some important dates to keep in mind for the 2025 challenge year. Letters of intent are due by the end of the year. These are really simple, and if you have questions about them, we can cover that in the Q&A section. If you've already submitted your letter of intent, thank you so much, and we have you. We're excited to see the work you can do. The challenge officially launches January 1st, but we will continue to accept letters and participation past that. We really want to engage with as many schools and communities as possible to really make the most impact each challenge year. And then reports will be due April 15th to myself. And in May of 2025, we will notify awardees and announce the winners. Next slide. So here we can see the impact the challenge has had in its lifetime. We have reached over 300 million consumers directly through media with participants in the challenge. We have held 2,000 individual events, and challenge participants have been able to directly distribute over 800,000 resources. Next slide. Some possible focus areas and suggestions for teams to hone in on are on this slide. Really, though, the challenge is incredibly flexible and allows you to meet your communities where they are and on the topics they need in the grander scheme of medication adherence. We do encourage you to try and incorporate some of these focus areas into your work as they are particularly relevant. So that includes vaccine confidence, which we have seen to be a continuing challenge for the past few years. Trusted information, focusing on navigating how to find it and kind of working against the rise of bad health information that we've seen. Over-the-counter safety, just because medications aren't prescribed doesn't mean they shouldn't be used as directed. Health disparities, this can cover a wide variety of topics and reasons, but data shows that lower medication adherence among minority populations is an issue. We also encourage you to focus on stigma and specifically disease stigma, the discomfort and embarrassment around a patient's condition can really negatively impact medication adherence. Um, and there's no need for it. Other kind of suggested focus areas include online pharmacy purchases and self-harm. But like I said, focus areas can be adjusted based off of what your community needs. We really encourage our teams to meet their communities where they are with what they need. Next slide. So after you submit your report, which we'll go over a little bit more, I think on the next slide, winners for the team challenges will be chosen by our judges. And these are the award categories we have for our awards this year. That includes the National Award, Media Communications, Technology Innovation, Interprofessional, and the Underrepresented Community Outreach. Next slide. So before we announce the awardees, obviously, you will have to submit a team challenge report, which should include all of the information on this slide, but in about 5 pages or less. We just want you to describe the activities that your teams completed throughout the challenge time period. So this includes your program intervention, a description of what you did, your events, your patient profiles, messaging, materials used, all of that. And then outcomes measured. So please tell us the event date, what that event was, population targeted, your number of volunteers and volunteer hours completed through this event, what materials you handed out, what participants you reached, that kind of stuff. Team impact, discuss how these activities conducted can change health outcomes in your communities. And then you can also include appendices with your report. So these can be things like event or activity logs, tracking outcomes and impacts. This can be press coverage from events. You can give us pictures and videos from social media that you used, or even just from your events. Letters of recommendation from groups impacted by the activities. Again, as I've mentioned a few times now, this challenge is very broad in what we do accept, and so that appendices are where you can really get creative and kind of show the impact you had. Next slide. So yeah, that is the quick overview of the challenge and of Script Your Future for the 2025 challenge year. Really quick, thankfully. So how about now we open it up for Q&As. We have the chat feature, or you can raise your hand and we can unmute you as well. And like I said earlier, this is recorded. We will circulate it after, and we do have an FAQ document, which we will circulate in relation with this. Any questions?
I'm not seeing any, so I'm gonna go to the next slide so that if people need to, they can write down any contact information for you or for me or Chelsea.
Perfect. Yep, like Madison said, here are our contact information, including the Script Your Future website, my email, and then Chelsea and Madison's emails as well. We also have, I believe it's on the Script Your Future website, a general Script Your Future email, which is just syf@nclnet.org. Email any of us with questions. We're more than happy to help. And we really appreciate your time being here with us this afternoon, evening, morning, depending on where you are. But yeah. Okay, then if there are no other questions, we will close it out. Again, like I said, thank you so much for taking time out of your day before the holidays and at the end of the semesters to be here with us for the kickoff. We really do hope to see you all participate in this coming challenge.